Welcome everyone. In today's video, we will be talking about the Gustilo-Anderson classification for open fracture. The Gustilo-Anderson classification system divides open fracture into type 1, 2, and 3. 3 is further subdivided into A, B, and C. The first criteria used to classify these fractures is the size of the wound. If the size of the wound is less than 1 centimeter, it is type 1. 1 to 10 centimeter is type 2 and greater than 10 centimeter is type 3. However, this is not the only criteria that is taken into account in this classification system. So let us see what are the other criteria. The first among the other criteria is the contamination of the wound. Now type 1 is usually an inside out puncture wound. So it will be a clean wound or will have minimal contamination. In type 2, there will be moderate contamination and severe contamination is classified as type 3. The second criteria is amount of soft tissue damage. 1 will have minimal soft tissue damage, 2 will have moderate soft tissue damage, and 3 will have severe soft tissue damage or crush injury. The third among these criteria is the fracture comminution. So type 1 will be a simple fracture or will have minimal comminution. In type 2, there will be moderate comminution and severe comminution will be classified as type 3. Now the mistake residents often make is not to take into account these criteria. So if a patient comes with 6 centimeter of wound with severe contamination, now a lot of times people will classify it as type 2. However, severe contamination falls into type 3. So ideally this patient should be classified as type 3. So whenever there is a criteria from the higher grade, we have to classify it according to the higher grade. Now let us see the subtypes of type 3. Type 3 has A, B and C. So 3A is either a wound of greater than 10 centimeter or high contamination or severe soft tissue injury or crush. However, in these patients, local soft tissue coverage is possible. So in 3A, local soft tissue coverage is possible. In 3B, it requires some sort of reconstructive procedure like a free flap. So if you cannot do a local coverage and require some sort of reconstructive procedure like a free flap, it becomes 3B. 3C is an arterial injury which requires repair for limb salvage. So if the patient has a arterial injury which will require a repair for the limb to be salvaged, then it is classified as type 3C. So friends, in this video we discussed the Gustilo-Anderson classification system for open fractures. This is a very important topic. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.